hello viewers. Welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in general medicine nowadays. So this video will be mainly focusing upon a very important short note, a very important question which is very frequently asked in the professional exams is about septicemia. So students and viewers, beginning with septicemia, in the previous video I've already said that septicemia, it is a condition where actually what is happening is that the blood what is containing the bacteria, in which the bacteria apart from multiplying, they are also producing certain amounts of toxins, and this is a condition. In the condition of septicemia, what the definition says is that the condition where the bacteria and the toxins are present in the bloodstream, and this is situation of septicemia is arising just because an infection is there in some part of the body. For septicemia condition, an infection has to be present elsewhere in the body, and from that site the infection is going to enter into the bloodstream and gain access and spread throughout the body. So actually basically it is particularly your lungs, and the infection site can be anywhere. Either it can be the skin, either it can be the kidney, either it can be lungs, or it can be the bladder. So in the condition of septicemia, any place where a particular infection is there, that infection is gaining access into the bloodstream, and that infection is present somewhere else in the body, and from that else part of the body, that infection, that bacterial spread of the infection is going to spread throughout the bloodstream. So such a situation, it is called as septicemia, and actually this is a very rapidly spreading situation, rapidly spreading condition, and the bacteria are continuously going to multiply. So actually what do we find is that there are certain situations, there are certain conditions where what is happening is that the infection is, if it is the region of if it is the skin, so actually these four things are involved. If the site of the infection, it is the skin, so either it can be a case of any kind of an abdominal injury or any kind of an abdominal infection if it is present, or if that is kidney, so in certain conditions of kidney infections. Apart from it, if the condition of, if it is affecting, if an infection is, it is present in the lungs, so that infection such as pneumonia, the infection of pneumonia is spreading throughout from the lungs, it is spreading throughout the entire body through the bloodstream. So this is again a most common situation for, most common condition for lungs. And if the infection, it is present in the urinary bladder, in conditions of urinary tract infections, so that can be the site from where the infection is going to progress into and spread into the entire bloodstream. So this is the condition or septicemia, and how this condition is manifesting. So actually what do we find is, now we need to understand that who are the people who are at a greater risk of this septicemic condition, because this septicemia condition, it is so rapid that once the infection at somewhere elsewhere in the body, it is gaining access into the blood, and this infection spreads so rapidly, the bacteria multiply so rapidly that the toxins what are being produced, that spreads enormously and at a very fast rate. It is going to spread throughout the body, resulting in various kinds of manifestations such as hypoperfusion of the vital organs, and ultimately that can lead to the failure of certain vital organs as well, it has been seen. So actually what people are at risk for developing this condition of septicemia. So this is very, very important, that if there are certain patient, if some patients who are admitted to the hospital for any kind of a surgery, so if they are already having an infection or a wound, so that infection can become that local site through which the infectious site, from where the bacteria can gain access into the body and can rapidly spread through the bloodstream. So it is the patients who are already admitted for any kind of a surgery, if they are having a deeper wound or an injury, if it is contaminated, if it is having those So the site, infection site, is present in such patients who are admitted for surgery, either in any way, either it can be an infection or through an injury. So if that area is non-healing and that the patient's immunity is compromised or the bacterial multiplication, so the site of the septicemia can be any kind of an injury site or an infectious site present in the body. So such patients who are admitted to the hospital for any kind of a surgery, in other conditions, what do we find? That immunocompromised patients. So the next variety of people who are at a greater risk of this septicemia, it is in the conditions who the people who are immunocompromised in any condition, such as the patients who are affected with the HIV, the patients who are affected with diabetes, the leukemic patients. So actually these are the patients, the diabetic patients, the leukemic patients, the patients who are infected with HIV. What is seen, that their immunity is already compromised, and once their immunity is compromised, so there, as compared to a person who's not, who's immunologically competent, so as compared to the patient who is immunocompetent, these immunocompromised patients, they have a greater chance of acquiring this infection. So they have a greater threat of getting this infection spread throughout their body. So the second people who are at risk of developing septicemia, it is the immunocompromised individuals who are having these conditions of immunocompromising conditions such as diabetes and leukemia. Apart from this, what the next important, the people who are predisposed to this septicemia, it is in babies and older adults. So as you all might be very well aware, that either it be that our childhood or it be the extreme elderly age, that is in the older age. See, both these two extremes of ages, they are having a immunity lower as compared to a normal um, youth age man. So what do we find is that the third people who are at a greater risk of the septicemia, it is in babies as well as in older individuals whose immunity is little bit compromised, just because their immune system has, in babies it is less developed, and in older individuals the immunity is obviously declining or it is compromised. So the third variety of people who are at the greater risk are the babies and the older adults. Up next, what next individuals, next variety, next risk factor, the fact people who are at a greater risk is that the patients who are on chemotherapy. So actually the patients who are on chemotherapy or on steroid injections, so we are very well, and we know this fact that the steroids have a very finds a wide variety of usage in a wide variety of treating medical conditions. So nowadays steroids are for every medical situation, every medical condition, the treatment drug can be a use of a steroid. But the adverse effect of steroid drugs administration is that it leads to immune suppression. So once the patients who are on chemotherapy, the patients who are having the steroid injections, they have their immune suppression has already been there because of their medical condition. So such people who are on steroid therapy or who are having this chemotherapy, they have a greater risk or they are more predisposed to the condition of septicemia. Next, what do we find is that in patients of weakened immunity, or they have weakened immunity, or they have certain kind of infections, and apart from this there are certain patients who are admitted in the hospital and who are on mechanical ventilators. So there are hospital acquired infections, so the patients who are on mechanical ventilators, apart from this the patients who have the urinary catheters, so if certain kind of an infection is there plus they are immunocompromised, there might be a possibility, there might be a risk that the septicemia condition can be seen in them. Now we move on to the clinical features. So actually when the condition of septicemia sets in, what do we find is that the patient is going to have intermittent high grade fever, that is pyrexia. Means the fever will be present at a certain time and it will disappear, but later on again it will reappear. So the patient may complain of this intermittent type of pyrexia or fever. Next, the condition, it is called as rigor. So rigor, it is a condition where the person will feel extremely cold and shivering, and later on the person will have fever with sweating. So this kind of a condition, it is called as rigor, and the patient may complain of chills. So the individuals who are affected with septicemia, they do have the symptoms of rigors and chills. So in rigors, the patient will have cold. Apart from this, the patient will again start shivering, and later on that will lead to a rise in temperature, and plus will be profuse sweating. So this such a situation, such a clinical symptom, the patient may manifest. Third condition, it is called jaundice. So as I've already said, if the bacterial infection is spreading throughout the body, it is spreading through the entire bloodstream. So what do we find is it can lead to the multiple organ failure. So ultimately the organs who are receiving the blood, they may get damaged. So a condition of jaundice can also occur if there is liver damage. Up next clinical feature, what do we find is that is the peripheral circulatory failure. So in peripheral circulatory failure, because the end organs are not getting the right amount of a blood, and the blood vessels, they are unable to supply blood to those vital organs, to the peripheral organs. So there is decreased peripheral circulatory failure is there. Apart from this, the next important clinical feature is the intravascular coagulation. Just because the septicemia is there, there is poisonous material spreading at an immense, enormous speed in the blood. So there is a possibility, there is a chance that there can occur disseminated intravascular coagulation. So there can be coagulum, there can be clotting. So disseminated intravascular within the blood vessels, there can occur coagulation as well. And lastly, if this condition is not treated urgently, so such patients, they need immediate hospitalization. They should not continue their treatment at home. They should immediately visit to their hospital, to the nearest hospital, and get it treated. So if the condition of the septicemia is not treated at the right time, the patient may even enter into a condition what is called as the septic shock. So septic shock, it is an intense condition where the body's is entering through a stage like the bacteria are multiplying, the toxins are rapidly spreading into the entire body, and that can ultimately lead to the circulatory failure, and the vital organs, they will be getting compromised, and that can ultimately lead to the failure of the vital organs. The next important clinical feature, what do we find is that septic shock, what is happening in condition of septicemia, it occurs secondary to sepsis. Now what is this sepsis? So in one line, what we can define sepsis is that sepsis is the body's strong immune response to infection. So if the condition, if the septicemia is not treated, so ultimately a situation, a condition called sepsis will develop. And in the condition of sepsis, what do we find is that the body's strong immune response will occur, and that will lead to the widespread inflammation. The entire inflammation of the entire body will occur. So body's strong immune response will happen, and that will lead to the widespread inflammation throughout the body, and ultimately this will lead to severe sepsis, and ultimately the vital organs such as kidney, the heart, failure can occur. So this is a condition that septic shock is secondary to sepsis. Now it is characterized by inadequate perfusion of the tissue. So ultimately, if the vital organs are not getting enough blood supply, so that is going to cause the inadequate perfusion of the tissue. And the last, that the septic shock differs from other shocks by having a hot stage before the cold stage. So what do we understand by the term hot stage? So in other shocks, whether it be the hypovolemic shock, the cardiogenic shock, and other shocks what are there, in the condition of a septic shock, what do we find is the hot stage is going to precede before the cold stage. So hot stage is that stage of the inflammation. Hot stage is that stage of septicemia where the symptoms what are arising is due to the hyperdynamics flow. So in hyperdynamic condition of blood flow, what do we find is that whenever there is an inflammation, the response of the body in the form of an inflammation, it is the components of inflammatory response such as the histamine, the serotonin, the bradykinin, and the endorphins will be secreted. So in the condition of septicemia, the hot stage is going to precede before the cold stage. So in the hot stage, the symptoms, the markers of inflammation, such as the bradykinin, the serotonin, the endorphins, these all will be secreted by the body. So that is the hot stage in which the components of inflammatory response are getting secreted in the body. Later on, that will afterwards it will progress to the cold stage where the hypotension will occur, and since hypotension is occurring, so that will lead to the in the later stages of septicemia, the patient may have cold and clammy extremities. There is delayed capillary refill, and there the pulse of the patient will become thready. So now we move on to the management. How to treat a condition of septicemia? So what do we find is that the management of the treatment of septicemia, first thing, that the management of the primary focus of infection. So what we have already understood, that the infection site can be the skin, that can be the lungs, that can be kidney, that can be the urinary tract, bladder, in anywhere. So wheresoever it is the primary focus of infection, the management of infection of the primary focus should be taking place. So firstly, we are going to manage that the primary focus from where the infection is spreading throughout the body, that should be treated first. And for that, broad spectrum antibiotics are given. And if the patient is having septicemia, so in order to maintain the perfusion of the vital organs, so in order to maintain the necessary perfusion, the blood and the fluid transfusion to correct the septic shock is given to the patient. Apart from this, the broad spectrum antibiotics are prescribed to the patient. And lastly, for such a situation or for such a condition of septicemia, the patient is given the hydrocortisone injections. So this hydrocortisone injection, it is a corticosteroid drug. So this injection of hydrocortisone in case of a septic shock may be useful to treat septicemia. So students and viewers, this was a very short discussion where I have tried my level best to simplify that what is the condition of septicemia, who are the people who are at a greater risk of developing this septicemia. Next, the clinical features what are seen in septicemia, and the treatment and management of septicemia. So viewers, in the professional exams for any of your MBBS, BDS, nursing, it is very important from the chapter shock if it is coming. So they can ask you about to write a short note or a long question in septicemia. If you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel, who haven't subscribed, subscribe. If you like this video, give this video a thumbs up. And don't forget to share amongst your friends. Thank you for watching.